The Delta variant is creating new COVID hotspots in parts of the U.S. The strain, first detected in India, is much more contagious. It now accounts for more than half of new cases nationwide. In Midwestern and upper mountain states, that number is closer to 80%. The head of the Centers for Disease Control said most counties with the highest infection rates are still largely unvaccinated. So far, 55% of Americans have received at least one dose of the vaccine. 47% of the country is fully vaccinated. As CBS's Michael George reports, Pfizer is asking for emergency authorization to administer a third booster shot, which isn't without controversy, in order to combat the Delta variant.
The NAACP put boots on the ground in Louisville neighborhoods where only 30% of residents have been vaccinated, hoping flyers and conversations get more people to get shots. But the effort comes as cases are rising in 26 states. Hospitalization rates are up in 17 states, 27% in Florida, almost exclusively among the unvaccinated. The far corners of Utah are hit hard, too.
We're seeing people that are extremely sick with it, a lot sicker than what they were the majority of the time in the wintertime.
But the demographic is younger since then.
What we're seeing is all the unvaccinated people. We haven't seen anybody that has been vaccinated.
With the pandemic persisting and the country yet to achieve herd immunity, there are questions about how long vaccinated people will remain protected. Questions like, will the 158 million fully vaccinated Americans each need a booster shot? Both the FDA and CDC said no yesterday. But both Pfizer and BioNTech officials announced they were seeking emergency use authorization for a booster because antibody levels in the blood may decline 6 months after immunization. Those studies dispute that, and leading physicians are counseling a go-slow approach. Dr. Celine Gounder is a New York infectious disease specialist.
I think the headline here is that if you have received both doses of the Pfizer or, for that matter, the Moderna vaccine, you are fully protected against severe disease, hospitalization, and death, even with the Delta variant.
For more about the coronavirus pandemic in the Midwest, I am joined by Mayor Brian Steele of Nixa, Missouri. Mayor Steele, I want to ask you first about your decision to impose a mask mandate back in October. That resulted in a lot of outrage and pushback from constituents, even though it ended in April. You're now facing a possible recall election in the fall. Why do you think there's been such a strong reaction in your community?
Thanks for having me, Lana. I think in our community, we really had a great amount of masking. The public really worked through that, and we're able to come together throughout the pandemic to really support one another and to support our community. There has been resistance in some places, but last fall we had a really high spike of cases. We had a lot of new cases, a lot of hospitalizations, and so we really thought that the masking requirement was really the best way to handle that problem.
Well, the mandate went into effect 8 months into the pandemic. Talk to us about the impact that COVID had on your community by that point and how that led to your decision.
Sure. Yeah, we had, pretty much the same path that a lot of communities across the country had. We had the initial stay-at-home orders that were required by our state. We came out of that and were able to get everyone back open and back to work. And we're very, very proud of the way we were able to do that. Then as COVID continued to progress and the pandemic progressed, we saw, again, that spike of cases, the spike of hospitalizations that led us back to requiring masking. Since that point,
now, Missouri has seen
Sorry, Lana.
Oh, sorry. I want to talk about what you're facing now then, because Missouri is seeing a rise in new COVID infections. It's being driven by the more contagious Delta variant. I'm wondering, given all that's transpired and continues to transpire in your community, are you considering enacting new measures to help curb the spread of the more contagious Delta variant in your community?
Well, our health experts are telling people to get vaccinated. That's their best defense against all the variants of COVID. We have vaccines widely available in our region, and that continues to be the message that we're putting out there is to get vaccinated to protect yourself, your families, and our community.
I understand that, Mayor, but Missouri's been lagging in COVID vaccinations. 45% of residents have received one shot. And in Christian County, where Nixa is located, your town, that number is a little bit more than 35%. What are you doing as mayor to try and ensure that your community is getting inoculated? And do you feel like you are still a powerful voice to try and persuade people, given that you're in the middle of this recall potentially, because you have tried to take steps to stop the spread of COVID in your community?
Yeah, I don't know what effect that has on it, but we definitely, as a community, as a city, as our local health experts, continue to put that out there and try to get more people to get vaccinated. Like I said before, the vaccine is readily available. There are 3 or 4 locations I could go today and get a vaccine. So we continue to press that, continue to try to bring more people in to get the vaccine. And I think, as the cases increase again, more people will again go back and get the vaccine.
But I understand that as a talking point, Mayor, and respectfully, I'm just wondering, since you have the Delta variant that is spreading in your community, you have a community that at least a portion of it is resistant to measures like mask mandates, and you have low vaccination rates in your community. How concerned are you about the impact that the Delta variant is going to continue to have there?
Well, we definitely have seen an increase in cases, and we've had it's stressing our local hospital systems. And again, our local Nixa is a suburban community. We don't have our own health department, so we kind of rely on those local health experts, and we continue to support them and back them to be able to push that message of vaccination to the community and to the region.
One other question about the recall, Mayor. The committee that's working on it said that your actions were, quote, illegitimate and possibly illegal. I want to give you an opportunity to respond to that and also to tell us about support that you've received from your constituents in the fight against COVID.
Yeah, I mean, I've received great support, not only from my city council, from other community leaders and business leaders, and just voters across my city. And so I think I've had very strong support. As far as the reasoning of why they want to do the recall, we were in a state of emergency. That was a state of emergency that was initiated by our city council unanimously, and that was where the authority for the mask requirement came from. I don't. You'd have to speak to them about what their motivation was, but I think we've done a great job within our community of fighting back against the pandemic and staying together and supporting our local businesses, our local school district, and so that's what we continue to try to do here.
All right, Mayor Brian Steele, thank you so much for joining us.
Thank you.